Welcome to another live hangout at Google+. Welcome to Breast Cancer Answers. I'm Dr. Jay Harness, the Medical Director of Breast Cancer Answers, and today we're going to have a really absolutely fascinating discussion about dense breasts and why dense breasts are important. And it is my real privilege to welcome Dr. Nancy Cappello. Nancy, good morning in Connecticut.
Good morning, and it's great to hang out with you, Dr. Harness.
It's great to have you here. Well, Nancy, I think probably the good lead into this is for you to share with me, like you've done in person, your own story, and that'll help us understand why you're such an advocate and a pioneer in the area of dense breasts. So please take the lead and share with us your story.
Sure. Well, I appreciate that because you're absolutely correct, Dr. Harness. Without my personal story of the tragedy of a late-stage cancer diagnosis, I probably wouldn't be doing this. I was a very faithful patient. I ate healthy. I exercised daily, even this morning. I don't have any relatives, first-degree relatives with breast cancer. I had my yearly mammogram. I never missed an appointment. And in 2003, I just received my 11th, I call it the Happygram, which said, "Dear Miss Cappello, we are pleased to inform you that the results of your mammogram are normal." I was 51 at the time. I was, naturally happy that my mammogram was fine. I was now 6 weeks later, I found myself, again, never missed an appointment, at my annual gynecological exam. As my physician was examining my breast, she said to me, "I notice a thickening in your right breast. I know you just had a normal mammogram, but because there's something palpable, you know the standard of care, Dr. Harness." They sent me on for another mammogram diagnostic, which showed nothing. Because it was palpable, standard of care, ultrasound illuminates a 2.5 centimeter something, which was later determined to be invasive breast cancer, which had invaded to 13 lymph nodes.
Wow, Nancy, holy smokes. Well, let's explain a little bit why the mammograms that you had weeks before didn't show anything. One of the things that I share with patients is that normal breast tissue is white on mammograms, and a cancer can also be white on mammograms. And if you have one superimposed over the other, white on white, you cannot see the cancer unless perhaps it's also making microcalcifications.
Exactly.
Or if it's causing what we call architectural distortion, where there's sort of a pulling of the tissue in that area. And in retrospect, and now that we know the results of the ultrasound, did the radiologist say, "Oh gosh, in retrospect, maybe there was something there"? Or did they say, "No, it's just absolutely nothing"?
Well, first of all, it was invisible by mammogram when they went back to look at it. And actually, now I have 6 doctors, of course, because I have advanced stage breast cancer. And each of my doctors, and again, I'm educated. I try to keep healthy. Sure. I read a lot. I was shocked, number one, that my cancer was so late. I wasn't shocked I had cancer because we know the majority of women that get breast cancer do not have any relatives or history that they would say, well, that's why I have it. So sadly, each of my doctors separately said to me, I said, "What happened?" I was actually shocked. Not to say I was also scared, am I going to live or die? Here I am with advanced stage breast cancer that the mammogram didn't see. I couldn't understand it. Each of my doctors said this, Dr. Harness. "Well, Nancy, first time I heard this, you have dense breast tissue." What's that?
All right. Well, Nancy, that's a good lead in. Just a couple things, though, before we go to what's dense breast tissue. People need to understand that screening mammograms are the best technology that we've got today.
Yes.
We are on the verge, hopefully, of whole breast ultrasound screening and perhaps even nuclear medicine screening. But the standard today is still digital mammograms.
Yes.
The sensitivity and specificity, big fancy medical terms, are not 100%. And so the mammograms become less sensitive the more dense tissue you have, or to put it another way, the less fat you have in your breast. Yeah. Conversely, the more fat you have in your breast, which is dark mammographically, the better the sensitivity and specificity of the mammograms are. But Nancy, you're the founder and director of RU Dense Inc. Please tell us about that and tell us what are dense breasts and take the lead, please.
Sure. So, you know, Dr. Harness, you're absolutely correct. I'm a consumer of mammography. I still, after 11 years since my diagnosis, almost 11 years, I still have my digital mammogram yearly. In fact, I have an appointment in about 4 weeks. So it is the first step. But for women like me, it may not be the last. And so here I am struggling. Am I going to live or die, number one? The first thing I want to know is, what does that mean, stage 3C breast cancer that had traveled to 13 lymph nodes? Well, it didn't look good. It didn't look good when I went online and found out what the rate of survival is.
Yep.
And so I wanted to get this information to women. What I also found out was that physicians, radiologists, have been reporting this to referring doctors at the time, 10 years ago, for 10 years in a report that the woman hardly ever sees about density. When I went back and got my report, Dr. Harness, every report, 11 of them, patient has extremely dense breasts, no change from prior exam. And my doc said to me, yes, Nancy, when I went back to them after I found out about dense tissue, what it meant, yes, Nancy, the cancer probably was, 3, 4, 5 years. And we just don't tell women about density. So I knew I needed to do something about this. I could not stop this. I had to get this to other women, and that's why we started our work, RU Dense.
Yeah, and you're a warrior now, a woman warrior on behalf of all women out there with dense breasts. And actually, Nancy, the reports that I look at come with percentage of density.
Yes.
And so I'll see a report that would say less than 25% dense or greater than 50 to 75% dense. So there's extreme density like yourself, sort of an intermediate density, and then low density.
Exactly, exactly.
But please, because this ultimately has led to legislation,
yes,
which we wonderfully have here in California where I reside, but please continue your story.
Well, so I went back to my docs when I started. I didn't know, I wanted to get information about this. I went to the literature because doctors weren't really routinely telling women, plus the fact there was nothing online at the time. This is 10 years ago. When I went to the literature, what shocked me and later outraged me was that there were 6 major studies that were over 10 years old, now 20, that said that as the density of a breast increases, the sensitivity of the mammogram decreases. It also said in the literature that 40% of women have dense breast tissue. I knew I wasn't alone. And the third thing was that there are other tools, such as, this is 10 years ago, such as ultrasound or MRI for at-risk women that can find cancers that mammogram miss. Then I said, back to my docs, here's all the literature. Shouldn't you start telling women? No, Nancy, we just can't do that. That's when my husband and I decided to do something. And in Connecticut, as you probably know, we became the first state in the nation to do 2 things. One, to offer ultrasound and MRI for women who have dense breast tissue paid by insurance. The third law we passed, which was in 2009, which is actually the second law we passed in 2009, was to report density to the patient through her mammography report. And that's what started an avalanche of women finding me to say, I want to do what you did, Nancy, in our state.
Yep. And so one of the take-home messages from our hangout today is that if you're having mammograms done, whether they're diagnostic or screening, you should ask the radiologist or your primary care doctor, am I dense? And if so, how dense am I? And further, if I really am dense, hey, what's the next step, particularly if I'm doing screening mammograms?
Absolutely. And the truth of the matter is I did not want to go to the legislature to get information, which is education to women. I expected the community to rally with me and say, yes, of course women need to know this. That wasn't the issue. The sad thing was we were getting physicians and cancer organizations opposing our work. And so since Connecticut passed in 2009, yesterday, Rhode Island became the 17th state to mandate reporting of a woman's dense tissue through her mammography report. And again, that was brought by a woman with advanced stage cancer, never missed an appointment, just like me. Many of the women I meet, most of them are just like me, Dr. Harness.
Yep. I got an email from you, Nancy, I think a week or so ago about Minnesota being the
Yes, yes,
16th state.
yes, yes,
Yeah,
yes.
yeah.
So
So,
within 2
Nancy,
weeks, 2 bills.
tell us exactly what the legislations require. In other words, these laws have been passed. What does it mean to radiologists? What does it mean to primary care doctors? What does it mean to people like me?
Well, you know, the thing that's important, Dr. Harness, and we know this, listen, legislation is not the be-all and end-all.
Sure.
It was my only way to get this information to a patient without going into every examining room. Now, it's the floor. So with legislation must come discussion, conversation between a woman and her healthcare providers, and based on her age, her risk factors, her density, all those things need to be considered so she can determine with her physicians her screening surveillance. That's the importance of it. I wish we had a standard national law. Now, we do have a House bill in the federal House bill. We're hoping to, we're near introducing it in the Senate. I'll be down in Washington next week. But we you know, unless we have that, we have to go state by state. You were right, Dr. Harness. I am compelled to do this because, again, I had late-stage breast cancer. I know the research. I am not in the woods yet. I do not want any other woman to have to suffer unnecessarily with a late-stage diagnosis.
Well, Nancy, so I'm familiar with a lot of this discussion, and by the way, I'm a strong advocate for exactly what you're doing. Thank goodness you're here. Man, if I were a legislator, I wouldn't want to have to take you on, kiddo.
You think so, huh?
Yeah, I think so a lot. You're not only knowledgeable but articulate and right there on the front lines, if you
thank
will.
you.
So congratulations. But one of the issues that comes up is, okay, I have dense breasts, let's say 75% or greater, or even 50% or greater for that matter. What do I do? Because insurance companies, by and large, are not covering, at least that I know, at least here in California, whole breast ultrasound screening, and they're not covering breast MRI. So I know now from your legislation, and my doctors told me I have dense breasts, now what?
Yeah. Well, you know, every state is different, and there's a lot of issues that go with this. But again, I always say all those issues about we don't have enough radiologists, it's going to scare women, should not trump that I should have information about my own breast tissue composition so I can determine what's right for me. However, we know that in some states, you know, there's all these coding issues. I mean, I never thought I would get into the weeds about medical stuff. I mean, I'm an educator. I'm not in the medical profession. Well, now I am, apparently, about breasts. But it's all the stuff that you get in the weeds. Oh, we don't know about workflow. And what about our insurance? And what about coding? Here's what I do know. That when I talk to friends across this country, that there are some insurance companies that if the physicians code it properly, that will support or MRI for high-risk women, clearly, typically 20% high risk, or 20% a lifetime risk of breast cancer. And I've also heard from women that when they appeal it on the second round, that's typically when they end up getting the insurance covered. But it is, yes, it is challenging. There's a lot of issues. However, give me information about my own composition of my breast, please.
Yeah, one of the debates, Nancy, that I'm sure you're familiar with, there is called the Akron Trial. And the Akron Trial has done all sorts of wonderful things. There have been different Akron trials organized through the American College of Radiology. And the Akron trials have looked at whole breast ultrasound screening. And you can comment on this. One of the downsides, if you will, are the false positives. In other words, something's found, a woman has a biopsy done, the biopsy ends up being benign, and they say, oh gosh, that was a false positive finding, this was an unnecessary. So what we're trying to do is sort of balance out, if you will, obviously having positive findings versus false positive findings. You want to comment about that, please?
Well, I do. Again, there's nothing worse than a missed positive than a false positive. Believe me. I mean, missed positive is tough. And we talk about the harms of breast cancer, the underdiagnosis and the overdiagnosis. Well, again, I'm about the underdiagnosis by mammogram alone, and that's why we do this work. In Connecticut, the practices, we started our law in 2009. We had an ultrasound screening bill, so naturally doctors have had practice, and they will tell me, Dr. Hooley, Dr. Weicker will tell me that they are getting better at figuring out what to biopsy and what not to biopsy. That's number one. We know that's true. The second thing is, I know there's been research, Kelly and Dean out of California with automated breast ultrasound, where actually their positive predictive value was the same as a digital mammogram. So I think there's ways to get better. And the third thing I will tell you, that when 2 national surveys and a state survey out of California basically when they've interviewed women or asked women about what they think about false positives, that they would rather have a false positive than a missed positive, and it doesn't deter them. This is the beauty of all this. Having a false positive actually makes women more diligent about getting their screening, because they say, listen, this is why I go for screening. I go for screening if in the unlikely event that I have cancer, it's found at its earliest stage. I mean, that's the whole purpose of this.
No, touche. I know Kevin Kelly. My institution actually, when he first came out with the prototype of his whole breast ultrasound screening tool, we were one of the sites that trialed that. So I know Kevin Kelly's work and know him. He is as passionate as you are about this subject. Yeah. And I think the other big names like Tom Stavros and the others, yes. I mean, Tom has written the Bible, if you will, of breast ultrasound, are really, really strong advocates for these kinds of technologies. So Nancy, on the bills that you're introducing at the federal level, besides being similar to what you've established now in 17 states, are you trying to get any mandates in there as far as other technologies for screening, or is just winning that first round the most important thing?
Here's what I say to all my critics. There's all these issues why we can't do this. Join us. Nothing better than having physician trade organizations and cancer organizations working with me on the federal level. That we would then get probably more technologies that would be part of the cadre of screening that would be offered after a mammogram, or add an adjunct to mammogram. The basic law right now is density reporting standard. But again, I would, and I say this all the time, I hear from doctors all the time, we need to have better standards for ultrasound as a screening. Okay, work with me. I'll help you. But I don't ever get the other part of it. It's like everybody wants to complain about what we need, but join us, help us, be together. We can do much more as a twosome than as a onesome.
There you go. Now, what other states is your legislation pending? We've got 17 out of our total cadre of states in the United States. Where else are you pending legislation?
Well, we have active legislation in Massachusetts, which is our neighbor to the north, which we're really thrilled to have. We also have Michigan. We have Ohio. We're also working with South Carolina. Missouri is on the governor's desk, so we believe that within days or weeks we'll have the 18th. We have still have some bills that receive lots of opposition, critics. Although I will tell you, Dr. Harness, what is so great about this work is that we're now getting many more physicians. In Arizona, a radiologist was the lead on the Arizona bill. In Tennessee, a radiologist was the lead on the Tennessee bill, which is now law. So we're getting many more physicians that are coming on board and say, yes, at the very least, let women know this.
Yep. Now, at the political level, thank goodness we have more women who are legislators, both at the state and federal level. How are you doing with your sisters in all of this?
Well, this may surprise you, Dr. Harness, but we have equal opportunity of critics, both genders, and equal opportunity of supporters, both genders. So it really has nothing to do with gender. In fact, you know, I remember being out in Nevada last year, and one of our fiercest critics was actually a female doctor. And I happened to be sitting in the audience ready to support the bill and testify. And I thought, oh, brother. But anyway, oh, sister. So we have females that are with us. We have females that aren't, I don't know. But I will tell you, I bet you those females that are in the profession, I bet you they know their dense tissue composition.
There you go. Well, Nancy, this has been an absolute delight. This information is really very important to our followers. As you may know, we have right around 700,000 followers right now at Breast Cancer Answers. What's our wrap-up? How would you like to close out this really delightful hangout that we're having today?
Well, first of all, thank you for inviting me, and we really do some great service, especially to the patient, to the woman. You know, believe me, Dr. Harness, I need to rescue a dog. I need to take golf lessons. I mean, I have a beautiful day right now in Woodbury, Connecticut, and I'm, you know, working 11 hours to get this information to the patient, to the woman. That makes a difference. But I would say that, you know, first of all, it's important for any person to take control of their own health. So I always pride myself of keeping healthy, exercising, eating right. And I will tell you that has reaped benefits, even though when I was diagnosed with late-stage cancer, 6 surgeries later, chemotherapy, radiation, hormone therapy, I mean, it was tough, but I will tell you, my preventative measures prior to that really helped me. I was never had to be hospitalized. And so I would say, do what you can to keep healthy. And for my physician friends, just give us the information. We can put on our big girl skirts or pants or whatever we need to do, and we can have informed conversations with our physicians about what we really need to do to find cancer early. If early really matters, give everybody access to it.
Well, let me share with you that early does matter. Let me share with you that living a heart-healthy style of life clearly matters, not only probably in some elements of prevention of breast cancer, but certainly surviving breast cancer the way you have with stage 3C now 11 years out. And let me close by also saying that knowing your density is really important. She's Dr. Nancy Cappello. Thank goodness she's one of our warriors when it comes to the world of breast cancer. Please join us on Facebook. Please join us on Google Plus and Twitter. We look forward to having you again at our future Google Hangouts. Stay tuned. We look forward to seeing you again. Have a great day. Have a great day.